While there is a lot of negative things framed in conversations like this, there truly is a lot of hope and a lot of possibility in having whatever life you desire.
Absolutely. I love how you worded that because our brains are actually wired to remember the negative. They're wired to remember that threatening thing that happened so that we avoid it the next time to protect ourselves and ensure our survival. We have to train it and wire it to remember the good things. And that's what this exercise does.
I am your host, Jason Hopcus, and today I have the honor of speaking with Dr. Jennifer Kelloff. Dr. Kelloff is a Colorado native who completed her medical training at the University of Colorado School of Medicine and subsequent pediatric and child abuse training at Washington University School of Medicine, St. Louis Children's Hospital. She has been with the Colorado Permanente Medical Group at Kaiser Permanente Colorado for the past 14 years as a board certified pediatrician, board certified child abuse pediatrician, the medical director of child abuse pediatrics and prevention, and has led their trauma informed care work. Dr. Kelloff co chaired the Colorado Fatality Prevention System Review Team and served on the Colorado Children's Trust Fund Board, both governor appointed positions. In the spring of 2020, Dr. Kelloff was selected as Colorado Permanente Medical Group's first medical director of social health, where she focuses on the intersection of social drivers of health with equity, inclusion, and diversity in childhood trauma and adversity to move these efforts forward. She is the mom to 3 boys and has traveled around the world and loves the outdoors. Dr. Kelloff, it's a pleasure to have you here today at Nobody's Perfect. I'm really looking forward to this conversation. And as we were preparing for this, just really the vital importance around kind of understanding and unpacking trauma and that its prevalence in all of our lives and how it can affect us not only in our youth but in our own lives as adults. So welcome. I'm grateful you're here today.
Thank you so much for having me, Jason. I'm happy to be here.
So as we dive into this at a high level, let's just talk about trauma, a little bit about what it is, what it isn't, and help us have a little more context for the conversation we're about to get into.
Yeah, absolutely. It's funny because I still encounter folks who say, we talk about trauma informed care, and they say, okay, are we talking about broken bones today? Is that what I'm learning about, or knee injuries? And in this case, that's not it at all, right? This trauma we're talking about is an emotional response to some adversity, some experience. And we've learned it is so common, as you mentioned, the prevalence of trauma. I really like to explain what it is in the context of ACEs or
Please.
adverse childhood experiences. And so, there was a study published in the late 90s. It's one of the largest epidemiologic studies that's ever been done. It was a collaboration between the CDC and Kaiser Permanente in Southern California. And what they did is they surveyed more than 17,000 adult Kaiser members. And so these are predominantly white, educated, middle class folks. And they asked them, before the age of 18, did you experience any of the following adversities? And so the categories of adversities are abuse and neglect. So physical, emotional, sexual abuse, physical, emotional neglect, and then household dysfunction or household issues, they've called it. And that really is, was there mental illness in the home? Did you have an incarcerated relative? Was there violence between your family members, really between the parent figures? Was there substance abuse or divorce or loss of a parent? And what was amazing about this is they asked before the age of 18, did you experience these? And then they looked at health outcomes in adulthood. And the interesting things they found were one, that it was very common. So more than 2/3 had at least one of these ACEs. And they found that 12.5% had 4 or more of these, which, we've gone on. There's been a small Colorado study that's shown the Colorado population has about 15% with 4 or more. What's profound about this is when you looked at the 4 or more in adulthood, they found that those adults were 12 times as likely to attempt suicide, 10 times as likely to have injected drugs, 7 times as likely to have alcohol use issues, 4.5 times as likely to use illicit drugs and depression, on to things like twice as likely to have heart disease and be a smoker, and 1.5 times as likely to have diabetes or be obese. And when they saw 6 or more, they actually saw a reduced life expectancy by 20 years. And so profound impacts that these adversities had then on adult health.
That's fascinating, and I'm just launching my first book, and I reference ACEs in that, and
Mhm,
I can wear the badge. I have 9 ACEs, so I am one of those people that falls into
mhm.
that category, and have had a
Yep.
tremendous story that brings me to fortunately do the work I do today. But what I'm hearing from you is it sounds like there's a real generational component to this. Like you experience something growing up, and then it goes on to
Mhm,
impact your life negatively or adversely as you move
mhm,
into adulthood. And it sounds like there's kind of a domino effect that
mhm,
can be led from this. Like, you know, as a parent, if you're listening, what are the things to be mindful of when we talk about ACEs? I mean, I know there's no
mhm.
great handbook for parenting, and everybody aims to do the best they can, and things
Yes.
happen in spite of our best intentions. But how, as a parent, can I be better informed around this concept and hopefully avoiding some of these outcomes that you're talking about with
Mhm.
us?
Yeah, absolutely. And what I was gonna say, that brought up as you shared, your ACEs with us is that, um, having them does not determine who you are or your health, right? So while we say it's really important and profound to know these things, it does not mean that's your destiny and that's what will happen. And so it turns out that resilience is the big factor in protecting against these ACEs. And so it's resilience that really buffers the toxic stress. So the health issues really come through what we call toxic stress. And so that is when, our body's natural response to threatening events, situations get stuck on. And so, I like to think about this or explain this in terms of, if you come upon a mountain lion in the woods, right? You're on a hike, you're hiking in Colorado, and you come upon a mountain lion. Your natural response is to fight, flight, or freeze. That is what has ensured our survival over our lifespans, right? Over our, generations and generations. But the issue is, what if that mountain lion lives in your home? What if that mountain lion is in your school and you are in this constant repetitive state of that fight or flight? That is what changes our physiology. That is what affects our neurosystems, our immune systems, our endocrine and hormone systems, right? So when you say, what can we do? We need to buffer that stress. We need to, one, try and remove that stress. So, some of it's knowing what's going on, working towards removing whatever that trigger may be, if that's possible, but knowing, asking questions about what that stress might be, and then buffering that stress to help break that staying in that activated state. So, we say, well, what is that? What does that mean? Well, one of the things that we know has the most profound impact on resilience is for children to have at least one safe, stable, nurturing relationship and environment in their life when they're growing up, when their brains are at this most sensitive time of, forming their connections. And so, what I think is profound about this is it turns out studies show it doesn't have to be their parent. And so when I think about some of the families who are working 2 and 3 jobs and they spend less time with their children than they would want to, um, if they can ensure that there is a person that exists in those daytime hours, they can still be there at night. Might be a coach, might be, you know, someone in the community, a neighbor, a grandparent. But when they have that, it turns out that is the biggest buffering factor uh, for reducing toxic stress down the road. So, I think what can parents do? Well, ensure that your child has a safe, stable nurturing relationship with an adult as they're growing up. Wonderful if it's you. It's okay if it's someone else.
I think
Um,
that's really
yeah.
wise counsel, and recognizing you use this word resilience a lot, and I want to go back to
Mhm.
in my sharing my ACEs score. You touched on something that is not necessarily a predictor of how your life is going to turn
Mhm.
out, and I want to say,
Mhm.
frankly, because of those experiences that I had, albeit a lot of trauma, it has led me to doing the work
Mhm.
that I'm doing today in service of
Mhm.
others, and in many respects, I
Yes.
have gratitude for that. You use that word resilience, though, and I think that's a word that's bandied about a lot these days. Like, explain to us a little more in layman's terms, like what is resilience? Aside
Mhm.
from having a stable adult, like
Mhm.
what
Yeah.
is the outcome of being a resilient human?
Mhm. Having resilience is really that ability to bounce back from things when they're hard. Something that is uh, big and hard and worrisome, and it's having that ability to bounce back, to be able to see it for what it is, not making it bigger than it is. We often will talk about, not catastrophizing what things are, which is really hard in today's society when everything is about the worst day ever, the worst, event ever, the worst, thing we've ever seen. So, really, I feel like, it's really that being able to bounce back when things are hard and tough and build on the strengths that you have to move forward and not getting stuck.
I love that, and I love how you framed for us so beautifully that element of maybe as a parent you're not the person that becomes this trusted adult that somebody can lean on, your child's life, and that's okay. Like, they're
Mhm,
finding that in a community. I think of the words, it takes a village. I mean,
mhm,
I even think about how much has changed since I grew up compared to the world we have today. It's fraught with challenges. It is a complex world. We navigate a lot of circumstances that are very different. I think being a youth
mhm.
and a parent in today's world is not for the faint of heart. Uh,
No.
so I guess the question, as an expert in this space and a medical practitioner that serves youth specifically, what are the challenges or the issues that you're seeing today that are different, you know, compared to earlier
Mhm.
and maybe we even talk
Got
about
it.
pre and post COVID.
Yeah, absolutely. I think one of the biggest challenges we're seeing is social media, right? Social media, phones, cell phones, watches, smartwatches, the pervasiveness of um, intrusion into children's lives, right? That some of that comes up with bullying, too. I think bullying has been there for a long time, but when it can come into your home uninvited on a device, when those things can happen over social media outlets, that is really difficult and challenging. I was just having a conversation, about how can we teach our children to set boundaries,
Mm,
to say no. Uh, and and I don't know that we have a great format for that yet. But the conversation centered around, a child whose parents were reluctant to get them some sort of device. They ended up getting an Apple Watch for their child in middle school. Um, and finding out that the child shared their number with someone who is texting them 30 times a day at
mm,
7 in the morning, at 9:30 at night. Pushing boundaries of asking questions that clearly the child doesn't want to answer and they try not to, and then pushing, pushing, pushing until they give some sort of answer. And so, it just made me think prior generations, right? My generation, if you liked someone, you called them on the phone and you had to decide if it was worth their parent knowing that you were calling, and you called at appropriate times because the parents would know you were calling. So I really think I see that the social media device piece is the biggest challenge that youth are facing today. I think COVID posed a big challenge as well. I think one of the biggest benefits that's come out of COVID is it's really shined a spotlight on mental health and wellness. And, one of my amazing colleagues always says, never let a good crisis go to waste, right? And so it's this like, this COVID crisis happened, and thank goodness we are paying attention to mental health and burnout. I like to call it moral distress because to me, if you traditionally think of burnout, it means you're just can't hack it. It's not quite, you're inadequate. And the reality is moral distress is really, it's the natural progression from the work we're doing, from the society that we're living in, from what's going on.
I really love that. And a few things that are sparking for me out of what you just shared is this topic around boundaries.
Hmm.
And really, as parents, I think most of us aim to set good boundaries, healthy boundaries for our kids. But it does also shine a spotlight back on the fact of, do we have the healthiest boundaries, especially related to technology hygiene,
Yeah.
as we're moving into these conversations? And then also,
Mhm.
this concept you talked about, access. You give your kid an Apple Watch, and your kid may not have the appropriate wherewithal to understand that person that's texting them at 30
Mhm.
times in the morning is not an
Mhm.
appropriate boundary, and then how to set that
Yeah. Yeah.
regressively. And I
Yeah.
also agree with you. I've said many, many times, like, one of the best gifts of COVID is that we are talking about things that should have been talked about far sooner, and mental health among them. I think the challenge I see, and I've worked with a lot of youth and families in the work that we do, the biggest challenge I see is you take a generation that was kind of ripped out of their formative socialization,
Mhm. Mhm.
into very critical periods. Like, do you think that continues to play out over the years as these kids age into adulthood?
Mhm.
Like, where does this go? I
Mhm.
mean, I'm glad we're talking about it.
Right.
Also revealed we have a system that was really never designed to meet the demand that's been
Mhm.
placed on it. So we're all adapting.
Yeah, absolutely. And I think as we're learning more about the negative effects of the technology piece, I think there is more movement for guidelines there too. And so I do think there will be some science-based guidelines that do come up. I think until that happens, though, right? We're doing our best to give the best advice to help set boundaries. And I would love maybe a different podcast for you to talk with someone about specifically, like, what words do children use to set those boundaries? We talk
Mm.
about, oh, saying no with kindness. Well, what does that mean? And what when the person doesn't take the no, where does that go? So,
That's a great suggestion, and absolutely something we should consider, because I think it's really hard. I mean, even as an adult, to navigate some of those blurred lines with
mhm,
technology and the access that we give people. And, especially when
mhm,
you're young, you know, I know a lot of your work is framed around trauma informed practices, and
mhm,
I would love for us to kind of dive into what trauma informed practice actually means, and then how is
mhm.
that integrated into the work that you do in serving youth?
Yeah, absolutely. Um, I think, the trauma informed care, kind of at its most basic form, is that shift in thinking from what's wrong with you to what's happened to you. And so, instead of when someone reacts to you, you have a negative interaction thinking, whoa, what a jerk that person is. You think, huh, I wonder what's happened to that person that's led to them to respond in that way. And what that does is it gets you to curious, we like to say. It gets you curious about what's going on. That immediately de escalates your emotions. It gets you to this calmer place. It gets you out of your emotional brain to your thinking brain so that then you can process and move forward from a grounded place. And so, we talk about using this trauma informed lens, and this is for, parents. This is for everyone. This is with your colleagues. This is with your children. This is really a human skill, a human lens that would be wonderful, for people to learn and to use. Um, yeah,
Yeah,
I'll
I
stop
love
there.
that, and I think if I think about it, it's more mindful interaction. and
Mhm.
really being aware of that, where we enter the conversation with somebody may not be the same place that they are, and
Mhm.
really just being responsive to understanding that we all are dealing with certain things, and
Mhm.
life ebbs and flows. I mean, that to me
Mhm.
feels like the net of this. If I'm a parent that's listening, how do I better integrate, this trauma informed approach in my parenting? I know you mentioned the differences between, why is my child doing this versus what has happened. Um,
Mhm.
how,
Mhm.
how can I practically apply this?
Yeah, yeah, absolutely. So I think that, as a parent, it's listening. We always talk, as you said, kind of being mindful, right? Being in the moment. When your child has things to say, listen, pause, see what you're hearing, listening for understanding and not to respond. Using that lens so that as they're telling you something, if you feel that emotion building, right? Take a breath. Think about why might they be telling me this about what's going on? Why? What's this reaction that I'm seeing? And then the next step is knowing that you don't have to fix it. So I think this
Mm,
is a key thing to know for parents. We call it resisting the righting reflex. You don't have to make it right. You don't have to fix it, but you have to listen and listen with empathy, ideally. And so studies have shown that, people who've experienced trauma report they actually feel healed simply by being listened to with empathy. And empathy, can be the thank you for sharing. I'm sorry this has happened to you. I'm sorry this is going on. You don't even have to say I'm sorry. Other points of view will say that's not something you need to do. I'm here with you. Thank you for sharing. And so I think as parents, we innately want to fix our children's problems, right? Or we want to fix everything. We want to help. And being able to take that space to say, take a deep breath, let's ground ourselves. And now let's listen, and I don't have to fix it. And I think that takes some of the fear away about having difficult conversations with your children to know that you don't have to fix it.
I love that, and thank you for validating that, because I think, and again, I think this is a conversation that not only applies to parents, it applies to navigating conversations in life with anyone, really. And I think
Absolutely.
humans, we're hardwired to be heroes. We want to show up for
Mhm.
people. We want to fix things that are wrong for them, and the reality is that's not our job or
Mhm.
responsibility. And I think what
Mhm.
you shared with us so beautifully highlights and underscores the fact that, just being present with somebody and listening can make such a big difference in the outcomes of what happens next for them. And nine times out of 10, most people don't have an expectation that you're going to fix something. They just want to
Mhm.
talk. So
Exactly.
I really love that you shared that. I guess the question I have, if I'm the parent that maybe has challenges regulating my own mood state, emotion,
Mhm.
like, and get really triggered by some of these things based on
Yeah.
my own trauma history,
Yep.
how do I show up and support myself first in that? I
Mhm.
your comment a minute ago about just taking a deep breath.
Yep.
Is there some practical advice you can give us around that?
Yes, absolutely. Um, In terms of, as a parent, what I would say is we always talk about you have to put your own oxygen mask on first, right? You have to take care of you to be able to show up well for your children and to help teach them. One thing, that we know is children mirror parent behavior. And so if you are chaotic and stressed and all over the place, our children are often chaotic and stressed and all over the place. So taking care of yourself is essential. Um, one of the things that I love for this is something called self compassion. And, I'm newer to this, and yet I think it's so profound. So, Dr. Kristen Neff has been leading the research in self compassion. And it's really, a powerful source of coping and building resilience. It turns out people who have more self compassion have less depression, anxiety, they show increased happiness, life satisfaction. One of the things things that I love is they've actually studied self-compassion in combat veterans. So high trauma, and those with higher self-compassion have less suicidal behaviors. And so I think it's just so profound to think, wow, if I can have more self-compassion, if I can build self-compassion. And this is something with resilience too, is that it can be learned over a lifetime. Some people are naturally resilient. Some people have to work at it, but it can be learned over your lifespan. And self compassion is something that you can learn and work on. So, self compassion is composed of three components: it's mindfulness, it's common humanity, and self kindness. And so, when we say mindfulness in this sense, really it's having that mindful awareness of our suffering, knowing about our trauma, our past trauma, our stress, our current stresses, being with it in the moment. So, not bearing it, pushing it down, not over identifying with it, not being overwhelmed by it, but simply sitting with it, acknowledging it, and being aware of it. The second, the common humanity piece, is then really thinking about our connection to others, knowing that you're not alone in your trauma, in your adversities, in your childhood trauma, in your current stress, because everyone has this. It's a part of being human, right? It's the human experience. Everyone suffers, everyone struggles, and you're not alone. And then the third piece is that self kindness. And so, really, it's that trying to have a kind and understanding response to the suffering. And so when we think for us, much of our self-talk is negative. Why did I do that? What's negative? But if you can try and talk to yourself in terms of how would you what would you say to a trusted friend? What would you say to your closest friend? How would you give advice and comfort them? And if you can do that yourself. So, if you want to Google Kristen Neff or self compassion, she has a 5-minute meditation that I think is outstanding. That is just this: pause for 5 minutes. It walks you through these 3 steps, and you go, wow, 5 minutes, I can do that.
I love that. And I mean, so many of these principles, like I understand um they're rooted in things that most people say this is going to be really hard. But the reality is
Mhm,
starts with a next right step. If you can listen to that meditation or get some more
mhm,
information about these things,
mhm,
I mean, the things that we've talked about here today, they are doable and they are
mhm,
possible to have a different experience and outcome in your life. So,
mhm,
if you're listening and things are not great at home or you have a challenging relationship with your child, like a lot of it starts with being in the right headspace before you go into
mhm,
that next conversation. But
mhm,
also, I think really reminding yourself that, you don't have to fix the problem. You may just need to show up and listen with some
mhm,
empathy. And I don't know about you, but for me, it feels like an amazing release valve just to take a breath
mhm.
collectively and say,
Yep.
gosh, maybe we're making it harder than it needs to be.
Absolutely. Absolutely. And that's that piece of like being in our emotional brain versus our thinking brain,
Right.
right? And so we go to that place and the breath takes us back into our thinking brain and we're able to think with our children. It can help your children to take a breath and help them to get into the thinking brain instead of the emotional and reacting brain. One of the other things I want to share, I love how you point out, there's some easy, tangible things we can do, excuse me, that aren't difficult. Um, there is a study out of Duke on 3 good things. And it's fantastic because what you do for 2 full weeks, ideally at bedtime, but it could be any time, if you can write down 3 good things from your day. It turns out after 2 weeks, it is better than an antidepressant. It is better than an SSRI in terms of increasing happiness, decreasing depression symptoms, burnout symptoms. And it turns out it's sustained for up to a year later when they study it. And so you go, a practical thing: 3 good things can take you a minute, could take you 2 minutes. If you like, if you're a journaler, you can take longer, but literally a minute every night at bedtime, acknowledging the good things is better than an antidepressant. You can also, get online and do 3 Good Things in Duke. If you put those together, there's something you can sign up for where they'll email you a prompt every day if you want. But I just think, goodness, practical things that we can do that have a profound effect.
I agree with you. And I mean, that it's interesting. So Nobody's Perfect was formed from this concept. I had a previous podcast with youth that was called Teen Talk. And the thread that was woven through all of those conversations was this high need for perfectionism. And what I stepped
Mm,
back from and looked at is that's not a youth problem. That's a people problem. Like we all
absolutely.
want to be
Mhm.
perceived as do perfectly. And there's so much pressure in doing that. And I think what you've just really helpfully reminded us of is it's those easy things that you can do with kind of commitment and consistency that can make such a
Mhm.
difference, and in what you
Mhm.
just shared perhaps have better efficacy than a antidepressant.
Mhm.
We just
Mhm.
launched a series at Nobody's Perfect Community called Simple Solutions to Support Yourself, and
Mhm.
I'm sorry, Simple Steps to Support Yourself. And really what it's framed around is those reminders of getting sun on your head, practicing gratitude like we just talked about, getting enough sleep, good technology hygiene, those things, drinking enough water, those kind of simple things that we can
Yes.
take advantage of that don't cost anything, that we have access to
Mhm.
24/7, 365. So I think there's an element of, while we've talked about at a high level trauma and the fact that it sounds like it's inescapable for virtually all of us, the
Mhm.
reality is there are some easy things that we can do,
Mhm.
and pick one. Start with one
Right.
thing that you think you can get to
Mhm.
commit to. If it's writing 3 things you're grateful for at the end of the day,
Mhm.
like, that's a
Mhm.
beautiful start. I mean, I can attest to it from my own practice that those things do change you and become the cornerstone for what potentially becomes the next step in your life. Like, there is,
Mhm. Mhm.
um while there is a lot of negative things framed in conversations like this, there truly is a lot of hope and a lot of possibility
Mhm.
in having
Mhm.
whatever life you desire.
Absolutely. And, I love how you worded that because our brains are actually wired to remember the negative. They're wired to remember that threatening thing that happened so that we avoid it the next time to protect ourselves and ensure our survival. And so we have to train it and wire it to remember the good things. And that's what this exercise does. The other thing that I love about what you talked about are those are really resilience building activities that you mentioned. So, getting out in nature, getting regular exercise, nourishing your body with healthy food, practicing mindfulness, getting mental wellness care when you need it, practicing self compassion. All of those things buffer that toxic stress. It can help break that cycle of stress, buffers it, takes you down, and helps treat the trauma. And we can see actually improvement in those neurologic effects of trauma, those hormonal effects. Sometimes we can see trauma, past histories of trauma can affect growth in children. It can affect number of infections they get. And those simple things that you've talked about can all lead to improvements
Mm.
in those systems that are affected in health.
And again, I just want to reiterate, they're free, they're accessible.
Mm,
You don't have to
yes.
make an appointment to show up in your office to see you.
Nope.
I
No.
want to end things on a hopeful note. And you've given us such incredible kind of practical information here on a topic that, frankly, is hard to unpack for most people. You hear that word trauma, we use it a lot. I'm not sure people actually always apply it in the right way. And I think having
Mhm.
conversations like this is so instrumental. Just at a high level, doing the work that you do with youth, do you feel like we are making progress towards becoming a more resilient society? Are we
Mhm.
really filtering this down and hopefully moving towards healthier outcomes based on these preventative approaches?
Mhm. Absolutely. I think the first step is this education piece. So having discussions like this. I do think, as we mentioned before, with COVID, really shining the light on mental wellness and mental health. And I think a piece of that has really been this. all that we know about trauma and resilience, creating this trauma-informed approach. And, in your prior podcast, you talked about trauma-informed schools, right? And and really, I think that with this education, people, more and more of the population, the community, not just the medical, community or the school community, as it becomes broader and understanding of trauma and adversity, recognizing it, how we can build resilience, that it's going to lead to improvement and all of these things. I think it can feel overwhelming and hard at times, when you look at what's in the media, what is going on in our world, and it can feel overwhelming. And I think being able to come back to that, if I can work on my resilience, if I can work on thinking differently about maybe what's happened to someone instead of what's wrong with them,
Mm.
that I can shift my thinking. I can help my children and my family and my neighbors shift their thinking. And then we have the ripple effects that go out and out. And really, we see a difference more globally. So I do think there's absolutely hope. I do think awareness is the first step. We're really working on that. I think we're gaining more and more data on evidence based ways that these things can be improved as well. And I do just really want to reiterate, you know, trauma, as you mentioned, it's a difficult topic, right? And there are differences in trauma and trauma that causes toxic stress.
Right.
And so, not all trauma causes toxic stress. When we do reach the point of toxic stress, there are ways to bounce back. There are things that can be done. Um, and sometimes that includes needing mental wellness care. Sometimes it's the little things that you and I have talked about today. And so I don't want to discount the need for mental health care, mental wellness care, because there are certainly situations where, trauma informed cognitive behavioral therapy, trauma CBT, right, that's needed. Um, I don't want folks to think, oh, they just said, trauma, and as long as I spend more time outside, that's all I need. But it's really that focus on there are tangible, easy, practical things you can do to help yourself. You have to help yourself in order to be able to help your children. You can then teach your children, those tools that you have learned to help them, and then they go on and pass those on to their children and on, right? It's this intergenerational piece um, that continues to improve life outcomes for folks as well.
I love that. And thank you for reiterating the importance of what I'm going to call capital T trauma and little t trauma.
Hmm.
There
Hmm.
are differences there, and there is absolutely, um, you should not hesitate to seek mental health treatment or care if that is required or necessary for you. There's oftentimes that there is no replacement for that, and we appreciate that. I'm so grateful for the work that you're doing that really is focused on being on the leading edge of helping us understand better around the long-term effects of some of these things in our lives and how we can have an active process in really kind of shaping or moving some of those things, regardless of what care is required or how you approach it. There is an impact in that, and I appreciate you giving us some hope about that. This is really valuable. One thing I always ask my guests before we leave is, what does nobody's perfect mean to you?
Hmm. Yeah. It makes me think of my children coming home from elementary school saying, Mom, today I learned practice doesn't make perfect. Practice makes progress. And I love it because when I hear that nobody's perfect, it makes me think you're right. It's about progress. It's about working towards bettering ourselves, bettering others, bettering our communities. And it's about progress, that there isn't actually that perfection.
Beautiful. I love that. Dr. Kelloff, it was a pleasure to have you here today. I am so grateful that you helped us unpack some of this and have a better understanding of trauma and how it affects our life, and the adverse childhood experiences, or ACEs, and then resiliency. Like, it's it's all important stuff. We should be talking
Mm.
about this a lot more
Mhm.
often. And thank you for helping us normalize this conversation from your lens and the work that you do. And thank you for your service and showing up for helping build healthier youth every day.
You're welcome. Thank you so much for having me. I've really enjoyed our conversation.
It was my pleasure. And thank you
Mm.
for being part of the Nobody's Perfect community dedicated to supporting, inspiring, and empowering youth and families. We hope you've enjoyed today's transformative conversation. Together, we are dismantling stigma and providing solutions for mental health and well being challenges so everyone can thrive. Join us every other week on cozy101.com/imperfect or on your favorite streaming platform to continue embracing our shared human experience. If you or someone you know is struggling with mental health, visit nobodiesperfect.community to get immediately connected to a hub of clinically approved mental health resources and tools designed to support you wherever you find yourself on your journey. And also be sure to follow us on at Nobody's Perfect Community on Facebook, Instagram, YouTube, and TikTok. I am your host, Jason Hopcus. It's been a pleasure having you here. Stay connected, stay inspired, and remember, nobody's perfect because perfection isn't real. Your story is. Until next
Mm.
time.